Hey everyone, this is Gary Anderson. Hope you all doing well. In today's video, I'll talk about diet and weight loss tips for thyroid patients. So if you like the video related to total health, I would like to request you all please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin, let's go. Losing weight can be a frustrating process for many people with an underactive thyroid. Whether you have hypothyroidism or no thyroid after surgery or radioactive iodine treatment, there is no question that for many that thyroid affects metabolism and can make weight loss an uphill battle. Here are some surprising tips that can help you finally tackle your weight loss frustration and get on track, as well as several diet and weight loss secrets to help you win the battle against excess pound. Get a diagnosis as quickly as possible. If your thyroid is underactive, a lack of treatment or insufficient treatment may make weight loss almost impossible. Despite diet and exercise, and the longer it takes you to get diagnosed, the more weight you could gain, while you are becoming hypothyroid even before your TSH is elevated enough to warrant treatment. Your metabolism can slow down significantly, causing you to burn fewer calories each day. Hypothyroidism can also make you tired, achy, and less likely to exercise, further reducing your metabolism. And when you are tired, you may eat more sugary food and carbohydrate for energy. If you have symptoms of thyroid disease, see your doctor right away and get informed about the diagnosis and treatment process. Look into optimal treatment. In terms of weight loss, relief of symptom, and overall good health for many thyroid patients, it's not enough for your doctor to diagnose hypothyroidism and hand you a prescription. In addition to standard treatment, you may need optimal treatment to ensure that your cells are getting the oxygen and energy they need to allow your metabolism to do its job. By the numbers, typically your thyroid stimulating hormone, which is TSH, is within the normal range for the testing lab. Your free T3 is in the top half of the reference range. Your free T4 is in the top half of the reference range unless you are on a T4 or T3 medication, in which case it can sometimes be lower. Just because your numbers are in the normal reference range doesn't mean that they are optimized for you personally. Everyone is unique and you may need a different level that someone else. If you are still experiencing symptoms, it's time to have a conversation with your practitioner about optimal hypothyroidism treatment. And if your doctor is only interested in getting you to the normal range, you may want to discuss this with them or seek a second opinion. Have your hormone level tested. Research shows that hormone resistance problem, including leptin resistance and insulin resistance, contribute to the difficulties many thyroid patients face in losing weight. And since both hyperthyroidism and hypothyroidism have been shown in multiple studies to create insulin resistance, this means you should consider having your fasting glucose and insulin level tested, evaluated, and treated. Fasting glucose level above 100 may be a sign of insulin resistance and prediabetes, which can make weight loss even more difficult. For very high level, your doctor may prescribe a type 2 diabetes drug like glucophage, which is metformin. For borderline levels, reducing the sugar and carbohydrate in your diet and following a healthy carbohydrate controlled diet can lower your blood sugar and help the weight loss. Now, we should consider hyperthyroid treatment options carefully too. You all need to think about whether to have RAI versus other hyperthyroidism and Graves' disease treatment. Weight gain after RAI is common. One study on patient who had a thyroidectomy found that those who did the surgery as their first line of treatment were less likely to become overweight or obese than those who had undergone RAI first. Talk to your doctor about your graves. Hyperthyroidism treatment options. Keep in mind that most patients who have had surgical removal of the thyroid, called a thyroidectomy or radioactive iodine treatment, end up with hypothyroidism. There can be a delay between your treatment and the start of thyroid hormone replacement medication, leaving you hypothyroid for an extended period. Change your diet. So there is no best thyroid diet, but making a significant change to how you eat is usually necessary in order to successfully lose weight when you have a thyroid condition. What type of diet to follow, however, depends on your unique psychology, food sensitivities, ability to absorb nutrient, and how effective your body is at metabolizing, storing, and burning carbohydrate. Among other factors, the key is to try different ways to lose weight, and when you find something that's working, stick with it. Some approaches to consider include cutting overall calories, use a calorie calculating app on your phone or computer to figure out how much to eat and everything you eat and drink. Upping your fiber intake. Getting a good amount of fiber is one of the basic tactics you can employ as a thyroid patient if you want to lose weight. It can come from high fiber food, supplement, or both. Limiting simple carbohydrate and sugar. Try following a low glycemic diet. An anti-inflammatory diet, the autoimmune protocol or anti-inflammatory or AIP diet may be a good option to consider. Then it comes to the paleo diet, an unprocessed, low sugar, whole foods diet. The paleo diet can reduce inflammation. Just make sure you're getting enough iodine. Now I'll talk about what is iodine and how does the supplement work. A low carbohydrate diet or very low carbohydrate diet, examples include the ketogenic diet and the Atkins diet, changing the timing of your meals. Try the intermittent fasting diet. Another approach that may be effective is the mini meal grazing all day approach to eating. Limiting your eating to 2 or 3 meals per day with no snacks and no food after 8 p.m. may help stimulate fat burning and help regulate hunger hormones. Getting tested for food allergens. Common allergens include dairy, wheat, soya, and certain fruits and nuts. If you find you have allergies to any of these, work to eliminate them from your diet. A gluten-free diet. There's a link between gluten sensitivity and celiac disease and the development of autoimmune condition including Hashimoto thyroiditis. Some patients have reported significant weight loss when they shifted to a gluten-free diet. So that's all about the fitness, the weight loss in the thyroid. I hope you all liked it. For all of you guys, I prepared a small presentation. Please do look forward that I will be going to share the link in the description box below. You can check it out from there, and I'm damn sure that will be going to help you in order to weight loss. So that's all. I would like to request you before signing off, please do like, share, subscribe this video with your loved ones so that they can also get the knowledge about this. So that's all. We'll definitely meet in the next video with my another content. Till then, God bless you. Bye bye. Take care.